Welcome to Live with Hillsdale Hospital. Today is Wednesday, September 3rd, and we're here to bring you, our listeners, our friends, our patients, the most up-to-date information on your healthcare needs and issues right here in Hillsdale County each week. It's so great to have you join us. We're excited today because I have a great guest in the studio. We have wonderful guests all the time, but I'm excited because this is a brand new service line to our hospital. Now, our community has had this before, but this brand new in terms of the hospital bringing the service to our community. So it is my pleasure to have here as the president and CEO of Hillsdale Hospital, a great friend and colleague, someone who is just new to Hillsdale, doing a tremendous job already. I've already heard the great compliments. It is my pleasure to welcome you to the studio and to our online listeners, Dr. Patel, podiatrist here at Hillsdale Hospital. Welcome.
Thank you, JJ.
It's great to have you here.
I'm happy to be here.
Now, take us through a journey.
Yes.
Because before we start talking a little bit about Hillsdale and what you do here, tell us where you've been,
Yes.
your studies, what motivated you to get involved in podiatry. Could you let our listeners know that?
Yeah, absolutely.
That'd be great.
Thank
Good.
you so much for having me today.
Absolutely.
I'm excited to be here. So I'm Dr. Patel. I am a surgical podiatrist at the Hillsdale Hospital. I'm from Pennsylvania and recently moved about a year ago with my husband to Ann Arbor, Michigan for his work. And that's how we found out about Hillsdale Hospital and the need for podiatry.
Yeah. So it's a remarkable story though.
Yes,
right?
It is.
Because you were just kind of surfing one day, weren't you?
I was.
And it was interesting because usually I spend a lot of time trying to recruit physicians to Hillsdale. Yeah. It's rare that a physician will email me, especially at 11 o'clock at night, and say, hey, tell me a little bit more about your hospital. But that's what happened.
That's exactly what happened.
You saw us online or something. Someone forwarded you something, or you did some research. Do you want to talk a little bit about that?
Yeah. So I heard from somebody about, need for podiatry in this area. And I happened to search. Found out Hillsdale Hospital is at this location and certain miles from where I live, and it worked out, and I just emailed you.
Yeah, I know.
And it worked out, and you emailed me back.
Well, I didn't even think it was a real person. I'm thinking, it's one of those AI generated bots,
but you took a shot.
But I did. I'm like, if it's real, it's gonna be real. And it was a real person.
It was a real person.
It was you.
And here I was.
Yeah.
And
prior to that, you were working, or right then, you were doing full-time, or
I was.
You were
back in Pennsylvania before we moved. I worked full time at the hospital in a location that's rural medicine. Where I provided podiatric services to the hospital and the patient in the community. Very similar organization as well.
And so you were kind of a hospitalist.
I was.
In podiatry.
Yes.
It was kind of a bigger hospital, though.
Yes.
It covered a lot of counties and a lot of areas.
It did, and it had multiple locations.
Yeah. And you were doing surgery and office.
Yes.
Right?
And wound care.
Yep. And then your husband has a chance for a fellowship, so you come to Ann Arbor.
Yes.
And then you're like, well, I got to work.
Yes.
You can't have the luxury of not working.
No.
And you find Hillsdale. We meet. I give you a tour. I think we both were like just enamored.
Yeah.
You were willing to come to here. Mm-hmm. You saw what Hillsdale could offer. You liked the smaller environment, but we also had subsects inside of our hospital, like wound care, that you were familiar with, right?
Yes,
you'd worked in wound care before. We need podiatry in wound care as part of the full continuum. So I really think that it was a great relationship that started. And within just a few months, we had you signed on and you were ready to come to Hillsdale.
Absolutely. And ever since, I have not looked back. I absolutely love it. The people here are so nice. Patients, office staff, hospital staff, everyone is so cooperative and willing to listen to you. I'm willing to listen, and it's a great relationship.
It is. So you've toured a lot of hospitals. You had a lot of choices.
I did.
You could have worked at U of M. You could have worked at Sparrow, all those places that you looked at. Why Hillsdale?
I like the family environment. I like the small community. It's not that small, but yet everybody, and you get connected. It's just easy.
It is.
to just, if I have a problem or issue or something I'm concerned about, I can talk to you, JJ, directly. And that will be solved.
Absolutely.
And that is what I like about it.
Absolutely. And that's been a wonderful relationship. You've been here several months now. You're starting to see a lot of patients.
Yeah.
You're booked up now. It's very good.
Yes.
But before we get into all that,
Yes.
let's just answer a general question.
Yes.
What is podiatry?
Great question.
What is it?
I do get that question.
And, what do you do as a podiatrist? So what is podiatry in general?
Yeah.
What does it cover? And what do you do specifically?
Good. Okay. So podiatry is a branch of medicine that involves foot, ankle, and lower leg concerns, complication, issues, problems, right? So I like to call it as a foot PCP, right?
Sure.
Because if you have any foot problem that includes skin, nerves, bony problem, fractures, let's say you have a small little mole on your foot and it's getting bigger by months and you're concerned, you think about seeing PCP or most likely dermatologist.
Yeah.
Quite frankly, I see them as well, and I can treat them. If you need a biopsy, I can certainly do that in office and get that treated and see what's going on with that.
Right.
So any foot problem that involves skin, nerves, vascular, or fractures, bone issue,
You're dealing
treat.
with it.
Yes, I treat it.
So most of the time, surgical intervention is not needed.
No.
But you do perform surgeries here. I want to get in that in just a minute. But you do get a lot of referrals, but you also get a lot of self-referrals. People to say, I need to see a podiatrist.
Yes.
And some of those things are like, for what reason would someone reach out to you?
Yeah, so for office-based, so different.
Office-based.
Yeah, exactly. So office-based procedures will be ingrown nails. Patients have ingrown nails from all ages. So I see them and I do procedure on the same day.
Same day, come
Same
in.
days, come in.
Cut the nail out.
Cut the nail out, numb the toe, cut the nail out, and patient walks very happily.
Yeah.
Yes, absolutely.
Yeah. Come back
in a couple weeks for a recheck.
Okay, very good.
To
So
make sure
everything's
everything's okay.
good, healing.
Yes. Absolutely.
Good.
Yeah. So things like that. If you have a neuroma on your foot and it's causing you a lot of pain, I do injection in office the same day.
Okay.
So that can also alleviate a lot of the pain.
Yep.
That's another one. For patients who are diabetics,
right?
For instance, this is a big one.
Yes.
And those patients who are at high risk for foot issues, who have very long toenails that can cause incurvation into the nail and ulcers and stuff like that.
Yeah.
I can see them in office, remove the nail if needed to be, and
Right.
things like that.
Right.
If they have calluses, which could turn into, if they're not treated right or patient have not seen a doctor for several months to a year, sometimes we trim, I trim down the calluses, make sure there is no underlying wound or open sores there. If there is, then I will treat those wounds in office. And if the wound is complicated, I send my patients to wound care, where I see them at wound care.
Sure.
Because wound care has more advanced modalities and wound care dressings and things like that. So it makes it easy.
Sure.
Yeah.
So I want to get into wound care in just a
Yes.
minute, because that's a whole separate.
Yes.
But let's go back to surgery.
Yes.
So when would you get surgical intervention? At what point in the
Yeah.
patient's journey?
Yeah.
They come to you first, obviously.
Yes.
Talk to us about what is going to the surgery.
Yeah. Perfect. So again, surgery is a next resort. I usually, let's say a patient comes with a bunion pain, right? They're having a lot of discomfort from wearing shoes. Routine lifestyle is affecting their job, involves to be standing for a longer period of time, walking and things like that. And they wanted to see me for their bunion and talk to me about it. Usually I start them with conservative treatments. Let's see if bunion sleeves work for them.
Okay.
Let's see if orthotics. I also do orthotics, give prescription and have them done.
Yes.
So if that helps, or go from that way, or specific type of shoes sometimes.
Because someone's high arch, flat,
yes,
whatever.
Exactly. Now, that's one category, right? So if my patient fails that, then we discuss surgical treatment options. Unfortunately, bunion is a deformity that involves arthritis of the joint, and we cannot fix it conservatively. It is only fixed with surgical treatment options. What we did conservative is putting a Band-Aid on it and see if the patient is happy with that. If not, surgical is always an option. Surgery involves, with the bunion, first I get x-rays. I look at the x-ray, we measure angles and choose the best procedure for that particular foot. So everybody's foot is different.
Right.
And depending on how their foot is, that's how I choose the procedure. And I talk to the patient about it. We sign consent usually first in the office, and then we pick out a day that works for them.
Okay.
Usually I operate on Friday afternoons. So depending on my schedule, patient schedule, we pick out that. Surgery day comes, we perform the surgery, we choose, I choose the hardware, screws, plates, whatever that needs to be done. Patient surgery is done. They go home the same day.
Right.
Okay. And there is a post-op protocol where I tell them not to put weight on it for a few weeks.
Sure.
Use a knee scooter if needed, and definitely a surgical shoe. Stitches come out. They have follow-up appointments and things like that at office as well.
Okay.
And routine X-rays to make sure that the surgery is healing properly, the bone is healing properly.
Yeah.
Yes.
Now, sometimes though, we have to go through a lot of work and paperwork to get people authorized for the surgery.
Yes.
That takes a while.
That does take a while.
Sometimes, but our office does all of that.
Yes.
The patient doesn't have to do any of that.
No.
They come in, consult. If you determine surgery is needed, we do the auth with the insurance, and then we get them in here for surgery.
Absolutely.
Right?
Yes.
So you do that. You get them on their way. They come back. Normally, when should someone go see a podiatrist? So is it should you go routinely? Do you need to go every year? Should you go once in a lifetime? What if I'm just a normal Joe? Out walking around. Is there a protocol? Like at age 50, I'm getting colonoscopies, but should our feet be looked at regularly, or what are your thoughts?
So two categories patient. If you are, let's say, like you said, you're 50-year-old healthy male, doesn't take any medication for anything, but you have a pain in your heel.
Okay.
And you think about it every step you're taking, or you think about it every other day that it's hurting you.
Right.
You need to go see a podiatrist.
Right.
Okay. So if you have pain, there is any concerning, like I said, like a small little mole on your skin, and you're concerned about it, it's getting a little bigger. The edges are little, it's not perfectly round, and you're just concerned. You come see me.
Okay.
So that's one. Patients, on the other hand, different category is diabetic patients. Right? That's a big one. Like I said previously, they need to be seen podiatrist at least once a year. And once a year. And from then, I will determine how often they will need to be seen.
Okay. Some brittle diabetics and some people that really suffer may be coming in monthly. Could that happen?
Yeah, absolutely. If they're seeing me monthly, then they are having a lot of complications, such as probably an ulcer or wound at the bottom of their foot.
Not healing.
Yes. And those patients who have, difficulty trimming their nails, in particular diabetics, they have calluses, and obviously they cannot get to their calluses. They will be seeing me every 3 months in office.
Okay.
Yeah.
So let's talk a little bit about relationships, because collaboration is important in your industry.
Yeah.
So when do you collaborate with, let's say, orthopedics? When do you collaborate with general surgery? When do you collaborate with plastics? I mean, when does all that happen?
Okay.
Because some people might say, you know what, the ortho clinic, they take care of foot and ankle.
Yeah.
So maybe if I'm having the pain, I should go to ortho. But you're saying, well, come to podiatry too.
Yes.
So it's a relationship, right?
Yes.
Now, do you get referrals from orthopedics, and then do you give referrals to orthopedics?
Absolutely.
Talk to us about how that works.
Yeah. So let's start with orthopedics now that you mentioned orthopedics. We definitely see each other's patient very frequently. Dr. Carr here is, trained foot and ankle and everything else, bone in the body. So he can definitely treat anything that I treat for sure, right? But sometimes those specific areas when it involves biomechanics and things like that, that's where my specialty, podiatry, we do excel in that. And for instance, if they have a patient that they see for a heel fracture, the calcaneal fracture, Dr. Carr treated it, had surgery, but they need something more, for instance, orthotics. He can certainly send a patient to me, and that's where I measure them and see how can we help them put orthotic in their shoe so they're walking pain-free.
Okay.
So that's one way for orthopedics. Another major specialty that I work very, very closely is vascular surgery. Okay. That involves patients who are a bit more complicated. And again, I'm talking about diabetic patients. When these patients have severe diabetes, uncontrolled, that affects everything in body, which also includes blood vessels.
Sure.
That's where the vascular surgery comes in. If they don't have good blood flow on their foot and they have a sore on their toe or an open wound and that is probing to bone, that wound will not heal if there is no proper blood flow. So that's when I call my friend Dr. Alam.
Yep.
And we talk about the patient.
Yep.
He will treat the patient with vascular issues, once he gives my patient a proper blood flow,
right,
then
you can go in.
I can go in, whether if they need a surgery to remove that infected bone, or if if there is no infection in the bone, then I continue do the wound. I will continue do the wound care at that point, to heal that wound.
Right.
Yeah.
So a lot of relationships.
Yes.
Vascular is very important.
Yes.
Dr. Alam, our vascular surgeon out at Three Meadows, does an amazing job. Please, 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 if you have any vascular needs, he's available. He works very closely with you. You work very closely with him. Yeah. And that's an important concept because he gets a blood flow there first, because that's important. And then now you can deal with it.
Yes.
Good relationship. Orthopedics, you're playing obviously referral and receiver in terms of getting those referrals in and giving those out as necessary. Yeah. Okay, so that's all good. Mm-hmm. Life is great. Yeah. You also, there are times in our life where, the healing process didn't happen. We have to do amputations. Yes. So you do those.
Yes, I do.
And you do those here.
Yes.
And would there ever be a complex something you would not do here, or you do every surgery is done here, correct?
Yes. Every surgery that involves foot is done here at the hospital. So like you said, the amputation, when there is patients with diabetic have lot of complex, and again, I'm going back to diabetes because
that's where it is, right?
It is. It really is. And it affects foot deformity. Patients have very swollen, deformed foot from diabetes.
Right.
And as a result, from pressure of walking on it, and they can't really feel it because of the neuropathy. Yeah. They don't know if there is a sore, or how big the sore is at the bottom, or how big the wound is. And before the time they come in, it's infected. And at that point, patient may need major foot amputations, which involves removing half of the foot, sometimes even leg. And when it involves removing the leg, that's when I call my surgical friends.
Yes, and you
Dr. March,
Dr. March, and collaboratively work with the team.
Yes.
Yeah, and hopefully we can prevent all that. Yes. Because that's the importance of going to regular appointments. Yes. Speaking of that, you take appointments now, right?
I do.
So how does that happen?
Yes. So my office is located at the Three Meadow Medical Building. Yeah. I am there 2 days a week, on Mondays and Wednesday from 8 o'clock to 4 o'clock at the office. You can call in at the same number.
We'll get the number up on the screen.
Okay,
so you don't have to worry about it.
Okay.
We'll get the number up there because you're in the surgical office.
I am.
So you're with Dr. March, and you're in with Dr. Morgan and their team. Yes. And I think it's a great relationship there because you do play an important role together. And then you're just one floor up from Dr. Alam. Yeah. And opportunities there. Then you got PTOT right down the road. So it's very good out at the Three Meadows service area. We're excited that you're with us. Let's close with this. You also have a relationship with our wound care center. Mm-hmm. So we have the Center of Excellence for Wound Care up on third floor of our hospital. We have hyperbaric chambers. But when do you get involved in that care as it relates to wound care on the floor? You go there once a week, correct?
I do.
So talk to us about that.
I spend half a day at the wound care center every week. Usually Friday mornings. That's where I see patients who have more complicated wound problems, which deals with their foot and legs. Okay. And again, most of our patients, sadly, they are diabetics. Mm-hmm. They are vasculopath, meaning they don't have good blood flow. Right. And that's how they're developing these wounds. And it is very difficult to close them because of that. But I do spend a lot of time at wound care center, treating wounds. When necessary, I do send patients for HBO as well.
So the HBO is the hyperbaric oxygenation chambers. And so essentially, we try to get them in there to heal the wound. Mm-hmm. We've had a lot of good success stories. Mm-hmm. Obviously, you support wound care and you support that program, but sometimes doing the debridements and the things that you have to do is in complement or a requirement for the insurance company before they can get the treatment. So you play a very important role in that.
Yes, definitely. There are requirements in order to qualify for HBO, hyperbaric oxygen treatment. And one of them is routine debridements, of course, depending, sometimes it is infection as well, vascular flap failures and things like that.
So would a patient see you on the wound care clinic and potentially in the office?
They can. Yes,
okay. So you have a relationship with both of that?
Yes, I do. I will see patient, let's say if they have an active wound, I see them weekly at the wound care center.
At the wound care center.
Yes. For their other foot complicated risk prevention, I see them every 3 months at the office.
Excellent.
Yeah.
So it's been great to have you today on the program, but it's even better to have you in our system here as a great provider. You're getting busy. Make your call now to get in to see Dr. Patel. It's so great to have you on the team, to have you involved in our wound care center, to have you out at Three Meadows. All very, very important.
Yes.
It's a continuum of care that we desperately needed.
Yes.
Your relationship with Dr. Alam and vascular, with general surgery, all very important
Yes.
in our continuum to take care of our patients. So thank you for joining our team.
Thank you for having me. I am very, very excited to be here, and I realize the need for podiatry service in this area, and that's why I'm here. And I'm here to stay.
Yeah, and I'm excited that maybe we even in the future get to increase your hours a little bit. But right now, 3 days is heavy.
Yes.
It's full time. I get that. But it's so great to have you here.
Yes.
It's been great to have you on the program today. So
yeah,
if there are no questions today, you can always drop us a question in the feed, and we'll be more than glad to answer that question or get a question over to Dr. Patel. A lot of people listen to this after it's a live event. We'd love to hear from you. We want to thank you, our listener, our patients, for joining us today, for being part of what we call our healthcare system in Hillsdale County. You entrust us to your care. You entrust Dr. Patel to deliver the best care, and they do. And the only way we can continue delivering that high level, high quality, low cost care is for you to continue to utilize our services. Hospitals across this country are in very big trouble. The recent federal legislation that guts Medicaid, the state budget last week that guts Medicaid, these are all very concerning factors for us in rural health, in particular rural health, because there's a disproportionate number of patients in rural communities compared to urban centers utilizing Medicaid and Medicare services in these rural communities, the very programs that our government's cutting, very concerning. So the way that we can increase our fight on this issue is to encourage our community to utilize our services, to increase the number of patients that come to our hospital. You don't have to travel to Ann Arbor, to Lansing. You can do it right here in your backyard. Make the appointment at Three Meadows, get the surgery done at Hillsdale, come into our wound care center. If you're experiencing pain, you got a pain clinic. If you're experiencing any other concerns or issues, you can get them addressed right here at Hillsdale Hospital. Surgery, right here. You need your blood work done right here at Hillsdale Hospital. X-rays that are done, all done in your backyard. The way that this is all possible to prop up healthcare in rural America is for you to continue to utilize our services and to understand that we can deliver that same level of care to you that you feel you can get at bigger hospitals. You get right here at Hillsdale. So if you want to join a winning team, Hillsdale Hospital is a place to be. We have about 25 open positions right now. It's the least number we've had in a long time. It's great. But go to our website, hillsdalehospital.com. A lot of nursing jobs, but there are some entry-level jobs. If you want to be a nurse someday, we'll sponsor that. If you want to be a scrub tech to go in the OR, we'll sponsor it. If you want to be a pharmacy tech, we can sponsor that. There's many opportunities for you once you hire in at that entry-level job. Sometimes it's environmental services, admitting, whatever it is, we get you hired in. You realize you really love healthcare, and we will help advance your education, your degrees, and ultimately can change your lifestyle forever, and you can impact our community. So give it some consideration. Hillsdalehospital.com. Look under the careers tab, and you can find all the job openings applied today. Maybe you just want to volunteer. There's plenty of opportunities. Go to our website. You can look for opportunities for auxiliary. Come in, reading to patients, sitting with patients, being part of laundry. There's plenty of opportunities for you to even volunteer. So you may not want to work here. Maybe you're retired. You can volunteer here. Or third, maybe you want to donate. There's always opportunities. We're non-for-profit. It's tax deductible for you to make a charitable contribution to Hillsdale Hospital. We'd love to hear from you. Reach out to us. Drop us a note in the Facebook feed. We'll be more than glad to answer any questions that are relative to Dr. Patel in podiatry, or any question that is. We want to hear from you. That is so important. But until next time, stay safe, stay healthy, stay Hillsdale strong when you choose Hillsdale first. We are rural health strong when we are together. Thanks for joining us today.